So one of the questions I get asked a lot is, what is the risk of surgery? In bleeding, infection, there are things that are risks with every surgery, but the big risk that we worry about the most is a blood clot. And a blood clot is something that it happens in your leg. We don't care really if it's in your leg, but if it dislodges and it lands in your lung, that's a pulmonary embolus, and it can make you not breathe, which is a big risk and something that could be devastating. So during surgery, we put squeezy booties on your legs to keep the blood flow moving. It's important for you to get out of bed after surgery. That is not laps around the neighborhood. That is getting up, going to the kitchen, getting up and going to the living room. So little tiny jaunts, but to get your blood flow moving. I do a risk score on all of my patients called the Caprini score, which is trying to assess what your risk is. If your risk is higher, we will do things like Lovenox, which is an anti-blood clot medication to use around the time of surgery. It is a risk of surgery though, and it's one that you need to be aware of and do things to try to optimize to avoid it.